Hi everyone. So in this very video, we want to talk about the different substances that can actually cause an addiction or one can actually get addicted to. Mind you, in our previous video, we talked about the concept of an addiction, right? So we also talked about it that substance addiction is a form of addiction amongst others, which in that very video, we talk about 10 different forms or types of addiction, right? For this very video, we're limiting it to just substance addiction. And we had also said in that very video that substance addiction do not just stop at the recreational drugs. It goes beyond, including the medical drugs, which are the over-the-counter drugs, all right? So we want to make a list of them on this very video. So we have the alcohol class. This alcohol class, especially there are three major ones, which are the beer, wine, and liquor. So especially that very beer, it's very challenging, and then the wine, very challenging to stop it when an addiction sets in. Reason being that it is socially accepted. So in almost all celebrations, you find out that there is presence of either beer or wine. The liquor may not, most persons may not want to engage themselves taking it. They already know that it has stronger effect on them. But for the beer, people don't mind. At least they'll take one bottle and so on. So continuous taking, you find yourself you're already addicted into it. All right. So next class of substances, we have the nicotine. This nicotine are any product that comes from tobacco. All right. So it may be cigarettes or the vaping devices. So the most challenging one again include that's added to the alcohol is this very nicotine, because cigarette in most places they don't consider as an issue at all. It's kind of socially accepted. Or the vape, which is either the electronic form or the traditional form. People don't see issue with it until they find themselves that addiction have crept in. So that's the point. They start looking for help. Now we have the opioids, which are actually which actually include the heroin, the fentanyl, the oxycodone, which is also known as oxycodone. Then we have the hydrocodone, also known as the Vicodin. We have the codeine and then the morphine. These classes, they actually fall under the opioids, right? So we have the stimulants. Now under the stimulants, we have the cocaine, we have the amphetamine, which may come in form of Adderall or Ritalin. We have the methamphetamine, which most persons know it, that's for the street name, the crystal meth. Then we have the methylphenidate, or which can also be sold in form of or in the name Concerta, right? So these are all stimulants. They keep the individual hyperactive, all right, or more or less alert. That's the right word. Keep the individual alert. Now we have the depressants. There are some substances that fall under that class called depressants, in the sense that their presence would depress the central nervous system, the functioning of the central nervous system, right? So under this class, we have three major ones, which are the benzodiazepine, the barbiturates, and then the sleep medications. So for the benzodiazepines, the common one is actually the Valium, the Xanax, and then the Ativan. All right. So we have the barbiturates. And there's what we call the nitrazepam, the lorazepam, and so on. Yeah, they are those class, right? So we have the sleep pills, which you may have the Ambien or Lunesta. All right. So these sleep pills too, continuous or prolonged use of them can actually lead to an addiction. Yeah, for sure. So even these benzodiazepine mentioned, especially that Valium, if you use it for more than 5 days, there's possibility that an addiction can actually set in, or dependence. Now we have what we call the next one, the cannabis, right? Under cannabis, it can come in form of marijuana, hashish, and then the synthetic cannabinoids. So this very one, this cannabis comes with different names. You might hear the scones, you might hear the igbo, you might hear the different names, right? They also the synthetic form of them too. There's a synthetic form of them. Yeah. So you have heard of loud, you have heard of colos and so on. Those are synthetic form of cannabis. So They are actually substance of addiction. The next one we have is the hallucinogens. Now, it comes from the word hallucination. Yeah, so hallucination is actually that state where you have a false sensory perception, whereby you start seeing things that others cannot see, hear voices that other persons cannot hear. You see or you get feelings of something that is not what is physically present. You can hear the individual say something is moving in my body or a snake and things like that. Then we also have instances where the individual perceive things where other persons present they are not perceiving that same thing. He can tell you that fear is actually smelling, whereas there is virtually nothing smelling there. That's the olfactory hallucination, right? So we have different form of them. So any medication that is capable to cause this altered sensory perception is actually classified under hallucinogen. Under it, we have the LSD, we have the DMT, we have the pyrite, we have the psilocybin mushrooms, then we have the ayahuasca. Yeah, these very substances they fall under hallucinogens that are capable to alter your normal perception. Then we have the inhalants. These are those ones that they inhale. All right, so they include the solvents, gases, and then the aerosols. So they can come in form of paint thinner, nitrous oxide. Now, if you have heard of people, there are people who go to sniff the soccer well, yes, to get high. That also comes under this very inhalants. There are people who perceive glues or fear, yeah, petrol, that's what I mean, fear, to actually get high. So it comes under this very inhalant. There are people who, which we'll talk about the spray, right? So there are people who actually perceive this very, let's say, perfumes and so on just to get themselves high. They fall under inhalants. They become in form of solvent, gases, or aerosols. Yeah. So we have the next one, which is our normal over-the-counter drug, also known as prescription medications. All right. So they may come in form of sedatives, tranquilizers, the painkillers, and then the muscle relaxants. Now, the sedative are those ones that helps an individual to sleep or relax well, right? So the tranquilizers are those ones mostly for people that are feeling anxious or unrest. So it helps them to relax well. So we have the painkillers, which are majorly for pain relief. So people can graduate from normal paracetamol. In fact, they start from the point where two tablets of paracetamol is no longer working for them, which is the 1 gram. They're now taking all as high as 2 gram, which is 4 tablets of paracetamol. Because paracetamol comes in 500 milligram composition, right? So they can graduate from there to even using tramadol, yes, as to help them with pains. They will also have things like pentazocine. These are mostly found among the medical personnel. Pentazocine, penta, because it is a prescription drug. They need prescription to get this very medication. So if you are a medical personnel, it may be less stressful to get it compared to other persons that are non-medical personnel. So we have the muscle relaxants and so on. So we have the designer drugs, which is are forms of the synthetic substances, right? Like bath salt, ecstasy, and then the spice. So this ecstasy can come in the name MDMA, right? So all these substances we have actually mentioned as substances that can lead to an addiction. The list is not exhaustive. I'm just giving us the common ones that you can easily hear out there. Alright, if you know any other one beside this very one, please let us know in the comment box. There are people who take some of these substances to enhance their sex life. So if you know any of those medications, or either prescribed or non-prescribed, that someone can take to actually get enhance their sex life, let us know in the comment box. There are forms of substance abuse. Yes, let us know any of them. Any of them you have idea on. Any of the substance you have idea on that we have not mentioned. Please let us know in the comment box. And then if you are suffering with any of them, yes, we can actually discuss on it and see how to help you come out of these forms of addiction. Thank you so much for staying this far. I want to specially appreciate you for always checking up on my video and other contents that are posted on this very channel. God bless you. See you on my next video.